Your cat can't tell you when something feels wrong. Instead, they use subtle changes in their behavior to communicate, and most owners miss them completely. Some of these signs are completely harmless, but others could be your cat's way of saying they need help. So here are 10 behaviors you should never ignore. And make sure you follow Animal Wisdom for more amazing cat and dog content. Number 1, they're hiding more than normal. Cats love cozy hiding spots, but if your normally social cat suddenly disappears for hours or even days at a time, it can be a sign they're stressed, scared, in pain, or feeling unwell. Many cats instinctively hide when they're vulnerable. A sudden change in hiding habits deserves your attention. Number 2, changes in appetite. Skipping one meal isn't always an emergency, but if your cat suddenly loses interest in food or starts eating much more than usual, it can point to an underlying health problem. Any major change in eating habits that's lasting more than a day or two is worth discussing with your veterinarian. Number 3, drinking much more water. If you suddenly find yourself constantly refilling the water bowl, don't ignore it. Increased thirst can sometimes be associated with conditions such as kidney disease, diabetes, or other medical issues, especially in older cats. It's a subtle sign many owners don't notice right away. Number 4, excessive grooming or stopping completely. Cats are naturally clean animals. If your cat suddenly starts licking one area obsessively, it could be caused by allergies, pain, skin irritation, stress, or parasites. On the other hand, if they stop grooming altogether, that can also signal illness or discomfort. So both extremes are worth paying attention to. A sweet cat that suddenly starts hissing, biting, or swatting isn't necessarily becoming mean. Pain is one of the most common reasons for sudden aggression. If your cat's personality changes overnight, it's worth looking for a medical reason before assuming it's just bad behavior. Number 6, changes in the litter box. Using the litter box less, going outside the box, straining, or visiting it much more often. These changes can signal urinary problems, digestive issues, or stress. Some urinary emergencies can become life-threatening very quickly, especially in male cats. Number 7, sleeping much more than usual. Cats do sleep a lot, often between 12 and 16 hours a day. But if your cat suddenly becomes difficult to wake, avoids activities they normally enjoy, or seems unusually tired for several days, it could be a sign something isn't right. Number 8, changes in their voice. If your quiet cat suddenly won't stop meowing, or your normally vocal cat becomes unusually silent, they're trying to tell you something. Changes in vocalization can be linked to stress, pain, aging, hearing changes, or illness. Number 9, breathing differences. Heavy breathing, open mouth breathing, persistent coughing, or breathing much faster than normal while resting. These are not typical cat behaviors. Difficulty breathing should always be taken seriously and may require urgent vet care. Number 10, suddenly becoming extra clingy. Some cats become unusually affectionate when they don't feel well. If your independent cat suddenly refuses to leave your side or starts following you everywhere, it isn't always just because they're feeling extra loving. Sometimes they're seeking comfort because something doesn't feel right. The most important thing to remember is that one unusual behavior doesn't automatically mean something is seriously wrong, but when your cat suddenly changes their normal routine or several of these signs appear together, it's always worth paying attention to. You know your cat better than anyone, and noticing these small changes early can make a big difference. So if you learned something new today, don't forget to like, subscribe, and follow Animal Wisdom for more science-backed tips to help you give your pets the happiest, healthiest lives possible.